My name is Meryl Marcigan, and this is my abdominal assessment video. First, I will scan the room. Okay. Okay. So I will start by knocking at the door, check my patient's chart, provide privacy. I will wash my hand, and then I will identify the patient with two identifiers. Hello, my name is Meryl Marcigan, and I will be your student nurse today. Can you please verify your full name and date of birth?
Mary Bordeaux, 6273.
Okay. Do you have a preference of Mary?
Mary.
Okay. Mary, are you having any pain right now?
No.
Okay. If the patient has a pain, then we will assess using PQRST for pain. Then I will start with asking subjective questions first. So Mary, do you know why you're here today?
Yeah, the doctor ordered this.
Yeah, I'm gonna do an abdominal assessment on you. So I'll ask some questions, and then I will inspect, auscultate, or listen, and percuss, and palpate your abdominal area. Okay. Okay. Do you have a history of reproductive cancer?
No,
Or
no cancer
anything?
in my family.
Okay. How have you? When was the last time you had your period?
It's faithfully here every month on the 7th.
Okay, so that's regular.
A
every
regular
month?
period every month.
Okay. Do you get a heavy period?
No, it's just normal, no cramping, nothing.
Okay. Do you get like a back pain?
Nope, none.
Do you do a self breast exam?
Yep,
How often do you do the breast exam?
once a month.
Um, do you have a problem urinating?
Nope,
Do you urinate at night?
yes,
Okay. How often do you?
once.
Okay. Do you have a burning sensation when you urinate?
No,
Have you ever seen blood in your urine?
no.
What's the color, normal color of your urine?
It's like I take vitamins, so it's usually bright
Okay.
because I take vitamins.
Is there like a foul odor?
Nope.
How about how often do you have bowel movements?
I have bowel movements about once a day.
Have you noticed any abnormal color on your bowel?
Everything is normal to me.
What's the consistency of your bowel?
Firm. I guess you would consider it firm.
Have you ever had diarrhea?
No, I don't.
Constipation?
Nope.
Okay. Have you been pregnant?
Yes. 3 C-sections.
C-sections? Okay.
Mm-hmm.
Have you ever had complications during pregnancy?
No complications.
Okay. So, if I have a male patient, then I will ask the patient subjective questions like, how often does he visit for physical exam, like the testicular exam, ask about prostate cancer. Mary, how often do you how often do you have your physical exam?
Once a year. I career.
Okay. Okay. And then for the male, I will ask for if they are circumcised, how often do they do their pericare, and any history of prostate cancer. Um, yeah. Do you have a history of breast cancer?
No.
Any history of um, cervical cancer?
No.
Okay. Okay, so Mary doesn't have any history of breast cancer or cervical cancer, so I will start inspecting her abdomen now. So I will inspect and then auscultate your bowel, okay? Alright. So her skin color is normal for her ethnicity. She has striation secondary to her pregnancy a long time ago. So it doesn't have any abnormal color in there. Her umbilical is indent, so and it's also midline, and she is not having any problem breathing. Her belly is like rising normally. The contour is flat and kind of round. Her temperature is warm, and skin turgor is not tenting. And then I will listen to your bowel sounds, okay? So for the normal bowel sounds is 5 to 30 per minute. So I will start at the right lower quadrant and then do a clockwise circular motion. And I will use the diaphragm to listen for vowel sounds. Okay, so she probably have between 10 to 15 vowel sounds in there. So it's kind of hyperactive, but if it's lower, it's hypoactive. And then I will also listen for bruit. So I will listen to for the renal arteries. It's on the left upper quadrants and right upper quadrants. And then for the aortic is the left and right lower quadrants. And then I will use the bell side of the stethoscope. Okay, there was no bruit present, And if it's a real patient, I will also listen to the femoral part, which is the at the lower part of the abdomen, and then I will do percussion. So I will look for dullness and tympani, and then I will do the same same clockwise rotation. Start at right lower quadrant. Okay, there was a dull at the right, both upper quadrants, right and left, and tympani on the both quadrants, lower, right and left. And then maybe because due to there's organs on the, like the liver on the right upper quadrants, that's why it has a dull sound. And then I will do a light palpation, same rotation clockwise. Let me know if you feel any tenderness. Okay. So for when you palpate, you do a circular motion. You feel anything?
No.
Did you feel any tenderness? Okay. Then since patient didn't have any tenderness, I also did not feel any mass in there. So I will continue with the palpation. You feel anything? No? You feel any tenderness? Okay, so no tenderness, and I did not feel any mass in there too. So the patient's abdomen is good. Do you have any questions for me right now, Megan?
No.
All right. So after the assessment, I will put the call light close to the patient, the bedside table, lower the bed, put the non-slip socks, and then ask the patient if she has any questions. So right now she doesn't. And then I will wash my hand, and then I will document any findings. And that concludes my video. Thank you.